Lecture in Rotary Endodontics 2 will be discussing about Protaper files and Protaper Gold files, which are currently used for undergraduate training. Uh, these files are extremely popular and they're in the market for a very long time because of its ease of use, simplicity, and efficiency. The Protaper files were introduced by D. Cliff Ruddle, later on popularized by Johann West, Ben John, and Dr. Pierre. Protaper means progressively taper, which are and made up of nickel titanium alloy. The progressively tapered design of Protaper increases its flexibility, improves its cutting efficiency, and the safety of these files. The change percentage of taper over the length of the cutting plates is a unique feature of Protaper files. If you look at the cross section of Protaper is a convex triangular which decreases the friction between the blades of the file and canal wall when the file is rotating within the canal and increasing its cutting efficiency. The design of Protaper files are modified guiding tip. It has got a rounded, non-cutting parabolic shaped tip. It follows the canal and loose debris into the interblade flutes. The variable tip diameters of Protaper file allows it to have a specific cutting action in defined areas of the canal without stressing the instrument in other sections. The changing helical angle over its cutting blades reduces the instrument from screwing into the canal and allows for better removal of debris. The benefits of Protaper design are increased flexibility. Each instrument produces its own crown down effect as larger tapers makes way for the smaller tapers. The Protaper files engage as a smaller area of the dentine, reducing the torsional loads and file fatigue, which may lead to instrument fracture. The Protaper file system consists of just 3 shaping and 5 finishing files. The first file of the Protaper system is an SX, which is usually used for shaping the coronal part of the canal. There are no identification ring on its gold or orange color handle. It has got a shorter length of 19 millimeters. The diameter of the tip, that is D0, is 0.19 millimeter, whereas the diameter at the end of the cutting blades, which is D14, is 1.20 millimeters. There is an increased taper up to D9 and then the taper drops off up to D14, which increases its flexibility. It is mainly used for shaping of the orifice as well as for the enlargement. The next file is S1, the first of the shaper series is an S1. Purple identification ring on its handle. The D0 diameter is 0.17 millimeter and D14 is 0.120 millimeter. It is mainly used for preparing the coronal part of the root. The file of the shaper series is S2, which has got a white identification ring on its handle. Diameter at D0, the tip is 0.20 millimeter, D14 is 1.20 millimeter. It is used to prepare the middle third of the canal. Coming to first of the finisher files F1, which has got an yellow identification ring. The D0 diameter at the tip is 0.20 and the apical taper is 7%. This is used to prepare the apical third of the canal. F2 has a red identification ring on the handle. The D0 diameter is 0.25 and the apical taper is 8%. Again used to prepare the apical third of the canal. The most of the canals are finished till F1 or F2 files, that would be like mesiobuccal and mesiolingual, mesiobuccal and distobuccal of the maxillary molars. But the palatal root of the upper molars or the distal roots of the mandibular molars are wider, so you may have to F3 files or more sizes bigger than F3 size. So F3 has a blue colored ring on the handle. The D0 diameter at the tip is 0.30 and the apical taper is 9%. Again used to prepare the apical third of the canal, usually canals which are wider at the upper. F4 file has got a black color ring on the handle. The D0 diameter is 0.40 whereas the taper is 6%, used to prepare the apical third of the canal. F5 double yellow color ring on the handle. That's a differentiation between the F1 and Fy. F1 has a single ring whereas an Fy has a 2 rings. The D0 diameter is 0.50 and the taper is 5%. So the next modification of Protaper Universal is Protaper Gold. They are gold plate files, which has increased the flexibility and greater resistance to cyclic fatigue whenever you're working in curved canals. The shorter handles of Protaper Gold increases the visibility and accessibility into the canals. The rotary system, the Protaper nickel titanium files substantially simplify the root canal preparation, particularly in curved and restricted canals. There are very simple rules whenever you are working with a Protaper system or any night-eye rotary system, that you have to frequently clean and inspect the files when you are using. Always use these files in well irrigated canals. Never force the instruments. Let the instrument slowly work to the working length. Determine exact working length, and recommended speed for Protaper is 150 to 350 RPM. Easy, you get the paper points as well as GP points, which exactly conform to the files of Protaper. So get the shaping with the Protaper sequence. The first and foremost important step is to create a straight line access to the canal orifice. Once it has been done, flood the canal with EDTA, such as glide prep. Passively scout the coronal two-third with 10 and 15 hand files. Gently work these instruments until you get a smooth reproducible glide path. You can also use a mechanized glide path files such as ProGlider or path files after the use of 10 hand files. In the presence of sodium hypochlorite, gently float the S1 into the canal and passively follow the glide path. Before you encounter light resistance, laterally brush and cut the dentine on the outstroke to improve straight line access and apical progression. Always remember to brush away from the furcation. Continue shaping with S1 until the depth of the 15 hand file size is reached. Use S2 exactly as what we have used for S1 until the depth of 15 hand file is reached. In the presence of sodium hypochlorite, just flood the entire canal with sodium hypochlorite. Um, Scout the apical one-third with 10 and 15 hand files and gently work them until they are totally loose at that length. Now establish working length, confirm patency, and verify the presence of smooth reproducible glide path until the apical one-third. Use S1 with a brushing action until the working length is reached, then followed by use S2 with brushing action until the follow working length is reached. I usually use 3 to 4 passes for each instrument, followed by irrigating with the sodium, copiously irrigating with full strength sodium hypochlorite. Try to keep the sodium hypochlorite inside the canal for at least for 2 minutes between each um, files, and at least 2 milliliters between each files when you are shaping. Now use a finishing F1 in a non-brushing action with each insertion deeper than the previous insertion until the working length is reached. Do not leave the file at the working length for longer than 1 second. Use peck motions. Okay, 3 to 4 passes are enough at the apical third. Gauge the foramen with a 20 size hand file. If the instrument is snug at this length, the canal is shaped and ready for obturation. If the 20 hand file is loose at this length, then proceed to F2. When necessary, F3, F4 and F5 with the same non-brushing motion, remember, to the working length. And gauge after each finishing file with 25, 30, 40 or 50 hand size files respectively. If necessary, you can also use an SX with brushing motion to remove the coronal aspect of the canal away from the focal concavities. During the entire shaping procedure, I prefer to use sodium hypochlorite as irrigating solution. As I said, there needs to be some precautions to be taken when you are using Protaper sequence. It's very important to get a straight line access while preparing the root canal. Multiple use disinfecting and re-sterilization cycles may lead to increased risk of file separation. So always try to use files for a single use, or if you're maybe a 2 to 3 users. If you are working in the a very tight canal or curved canal, always restrict to use the files for single use. These instruments should not be immersed in sodium hypochlorite solution. You have to take care of that one. Clean the fluids frequently during instrumentation. Inspect very closely for any signs of distortion such or wear such as uneven fluids or dull spots. Frequently irrigate, recapitulate, and irrigate the canal throughout the procedure minimally after using each file. Protaper gold files should be used in the regions of canal that have confirmed and reproducible glide path. Establish a reproducible glide path using hand files, at least an ISO 015 size. Use shaping files S1, S2, and S6 with brushing action or withdrawal stroke in order to create an straight radicular access to the apical part of the canal. Use finishing files with no brushing action. Remember, we do not use the brushing action for the finishing files. Only for the shaping files we do use brushing action. Finishing files are used for peck-like motion, reaching to the apical 1/3. 3 to 4 passes, that is more than sufficient for Protaper sequence. Always remember to use minimal apical pressure. Never force the files down the canal. So these are the precautions to be taken whenever you are using a Protaper sequence. The clinical demonstration as well as demonstration on an extracted tooth will be given during your postings. That is all for today's lecture. Thank you very much.